What's up, beautiful people? Another day, another study. Inflammatory rheumatic diseases, or IRDs, are becoming more common, affect over 8% of women and 5% of men. And these are things like psoriatic arthritis, rheumatoid arthritis, and SLE, lupus. So these diseases are also associated with anxiety and depression, and this can lead to a vicious cycle where you get physical symptoms that worsens your mental health, which then worsens the physical symptoms, and so forth. We know that cognitive behavioral therapy is an effective intervention for the psychological distress in IRD. However, there are limitations for in-person visits, whether that's insurance coverage or people in your area that know how to effectively do cognitive behavioral therapy. This was a 12-week randomized pilot controlled trial where they had a self-guided web-based cognitive behavioral therapy intervention for reducing psychological distress and improving quality of life in patients with IRD. If you viewed my channel, you know I'm very bullish on digital interventions, especially interventions like this, delivering cognitive behavioral therapy or group exercise or group coaching. We've seen literature repeatedly that these interventions are effective, and that's fantastic for improving access for people who have these conditions. So compared to the placebo group, the intervention group significantly reduced psychological distress. The intervention group was 181% more likely to have a minimal clinically important difference for a change in a score called HODS-D. There was also significantly higher quality of life improvement in the intervention group. In fact, they were 161% more likely to achieve the MCID for quality of life improvement. And the secondary analysis scores on depression questionnaires, anxiety questionnaires, and stress questionnaires improved significantly in the intervention group. No significant difference was seen in pain rating scores at the end, maybe because the trial wasn't long enough. But there were no intervention-related adverse effects, which is great. So this is another study, and we need confirmatory studies, larger studies. This was just a pilot study, but it adds to the overall body of evidence showing that digital interventions can be successful in improving various outcomes in patients.